The Nairobi Hospital Accident and Emergency Center is conveniently situated next to the main entrance of the hospital along Argwings Kodhek Road, with close proximity to the laboratory, radiology, theaters, labor ward, cardiac catheterization lab, and critical care units. We are open 24 hours a day, 7 days a week, including public holidays, to handle people of all ages presenting with all types of illnesses and injuries. The department is run by professional clinical and non-clinical staff, headed by an emergency physician in collaboration with a unit manager, and it is equipped with modern medical equipment. The doctors and the nursing staff at the accident and emergency have specialized training in trauma and emergency care, advanced cardiac life support, advanced pediatric life support, emergency triage assessment and treatment of patients, and advanced trauma life support are able to handle any life-threatening emergency cases. All the doctors and nurses at the Nairobi Hospital Accident and Emergency Department are trained in disaster preparedness, and the hospital is linked to several rescue teams and other hospitals. The Nairobi Hospital disaster preparedness has been tried and tested and noted to be above board par excellence, with optimum care of victims during disasters such as the Westgate and the Dusit terrorism attacks, the Msogari students accident, small plane crashes, and road carnages, with a number of casualties. Skill checks and disaster preparedness are carried out regularly. The department is renowned for its efficient handling of trauma patients. The security personnel at the emergency entrance alerts the emergency team of any incoming ambulances or vehicles. The team, led by an emergency team leader who is a doctor, rushes out to assess the patient and determines the required level of care. Resuscitation is carried out in a well-equipped room with facilities for continuous monitoring of cardiovascular and respiratory systems. Intubation and respiratory support are carried out by a team of well-trained doctors and nurses. The healthcare provided is, as per the emergency protocols, well displayed in the room for reference that meets international standards. Support for 24-hour laboratory ensures availability of blood and other emergency laboratory tests. Portable X-ray and point-of-care ultrasounds are carried out within the resuscitation room for quick decision-making. We have a dedicated in-house mini laboratory and radiology to help shorten the turnaround times of tests. The Accident and Emergency Department is divided into 3: emergency area, observation area, and non-emergency area, that's walk-in. Each section has got its own allocation of staff. Unlike other walk-in, outpatient walk-in centers, at our emergency center, the patient is seen first at the triage by an emergency specialist nurse who takes a brief history and checks vital signs that helps prioritize patients according to their severity of their illnesses. This ensures that we manage all emergencies in a timely manner, ensuring safety and quality care of all patients. On a daily basis, we have call experts in cardiology, neurology, orthopedics, surgery, obstetrics and gynecology, general medicine, pediatrics, anesthesia, infectious diseases, etc. Recently, we opened a VIP/KHA Express clinic on the first floor with full staff complement for fast-track services. Patients can be seen on either booking or walk-in, and patients in our VIP Express clinic enjoy a hybrid process flow with almost all services rendered inside the room. The patient is escorted to the radiology unit and other procedures which are out of the department and later brought back to the department. Additional services that we offer: patients can be dropped off at the front entrance of the Accident and Emergency Department. We provide ambulance services for emergency and scheduled transfers in and out of the hospital. We also offer Medivac for our international clients coming from the airport. You can reach us for ambulance services on 0722 470 823. The Nairobi Hospital has got a helipad next to the Doctor's Plaza to receive airlifted patients who are critically ill or injured requiring emergency medical care. Reserved parking is available outside the Accident and Emergency Department for emergency cases, and normal parking areas at the main hospital which can be accessed through Gate A or Gate 2.